New baby is the beginning of all things like wonder, hope and dream of possibilities. And watching this baby grow in the womb is an incredible experience, which is now possible with the help of ultrasound. Hi everyone, I am Dr. Shairy Goyal and I am radiologist at Dr. Shairy's Ultrasound Centre. Today in this video, I am going to talk about when, why and how many times an ultrasound should be done in the pregnancy. So first is the early pregnancy scan, which is done between 6 to 7 weeks of the pregnancy, that is 10 to 15 days after you have missed the first period. This is also known as a dating scan. This scan is very important as it confirms the pregnancy. It also tells whether the pregnancy is intrauterine or extrauterine, that is the ectopic pregnancy, whether it is a single pregnancy or multiple pregnancies, and whether the heartbeat has appeared in the fetal pole. So second is the NT or NB scan, which is also known as the early anomaly scan. This is done between 11 to 13 weeks of the pregnancy or in the late month of the third month. This scan is very important so as to rule out any chromosomal anomalies like the Down syndrome, trisomy 13 or trisomy 18. In this scan, as the name tells, it is an NT scan or the nuchal translucency scan, in which we measure the thickness of the skin at the neck level. So and also we measure the nasal bone. So these two things helps to rule out any Down syndrome. Other than these two things, there are other parameters also which are seen in the early pregnancy scan, like the fetal cardiac screening, and also the other organs which can be seen at this time, like the fetal brain and the fetal abdomen and the fetal limbs. So after this scan, the third is the anomaly scan, which is also known as the TIFA scan or Targeted Imaging Anomaly Scan. This scan helps us to rule out the chromosomal anomalies, as in this scan we check all the body organs of the baby, including the brain, the fetal heart, the fetal abdomen and the fetal limbs. Any anomaly in the baby is detected at this scan. Other than the anomalies which are detected at this time, we also look for the cervix of the patient. This also helps in detecting any preterm labor. Other than this, the blood flows to the mother are also checked. This will help in detection of the early PIH. After this anomaly scan, there are growth scans which are done after 28 weeks of the pregnancy. In the growth scan, we detect the growth of the baby. Is it fine or not fine? Other than the growth, the amount of liquor or the amount of fluid which is surrounding the baby is also checked. To know more about the details of each scan, please watch my other videos, and if you do like them, please share and subscribe to my channel. Thank you.